Hello, my name is Erica Smith, and I'm a part of the traditional BSN program at Nebraska Methodist College, and this is my Educated Citizen portfolio presentation. The topic that I chose is sexual assault on college campuses, although I kind of just geared it more towards sexual assault in general for this presentation. The reason why I chose sexual assaults on college campuses, honestly, out of the long list, this is the one that kind of drew my attention. I really wanted to learn more about it. I wanted to learn the statistics on it and really see what I can do to make a change. So that is why I chose it. So to start off, I want to talk about what an educated citizen is. According to Nebraska Methodist College, an educated citizen is a competent practitioner, an engaged citizen who responds productively to the complex dynamics of the world, utilizing a diversity of disciplines and perspectives. There are three different types of an educated citizen, the first one being an effective communicator. They use critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. Then there is a reflective individual who routinely engages in habits of injury that influence ways of thinking and actions. And then the last one is a change agent. They use the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence and to take appropriate initiative to effect change. So my first experience of an effective communicator. So what I kind of did to think about mine was I looked at my paper and I thought, what can I ask a question of that kind of broadens this? So the question that I asked was, what happens when you do not have a proper dialect on your translation device? All throughout nursing school, we've learned you need to have an actual translator. You need to have a translator at bedside. Family, friends are not the best ones to choose from, as they can be biased. You need to make sure you have an actual translator available for these patients. Well, at Methodist, we have Marty's, and we had the language, but we did not have the dialect of the language. So although the patient understood some of it, he didn't understand a lot of what was going on with his care, and so this really made a change. Big effective communicator. We really had to focus on the nonverbal cues. We had to really look at the things of what we usually wouldn't do with someone if we had an actual translator. We used communication boards, and we did also have to call his daughter because before all of those things were working, we had to tell him what we were doing and how we were using these so that he would understand. And so although family is not the best, in this case, it is what we had to do to get this patient to calm down and understand that we're trying to help him. And so after talking with his daughter and informing about his communication device that we found and explaining it to him, we were able to move forward and assist this patient with all of his needs. And so what I learned from this is we really need to focus more on nonverbal cues for patients. Nonverbal cues are a big part of what we look at when we assess a patient, but we don't really think about it of how we communicate with them. At least I don't, not before this experience. And so without the ability to communicate, I was pushed to step out of my comfort zone and do things differently than I would with a patient that did speak English. I caught myself pointing to things at first to see if the patient understood, and he didn't. And so we had to use his daughter as a resource and inform her of all of the things that we were going to do that night so he wasn't shocked when we had to come in and help him. And so overall, being an effective communicator is not always using our voice, but utilizing our nonverbal cues that can make a difference. And so connecting this to sexual assaults, following a sexual assault, the victim may not be ready to talk to someone, especially if it's someone that they don't know. So following a sexual assault, it can leave the victim feeling ashamed, having a scattered mind, and feeling alone or scared. Because of this, it is very common for victims not to want to talk to anyone, especially people they don't know. And so finding ways to connect with them and showing them that they are safe is one of the most important things that we can do. And so pushing out of our comfort zones to try and connect with them can truly make a difference in their recovery. And then my second experience for an effective communicator, I asked, what happens when a patient doesn't want you in their room? And so During my second semester of on-site patient care, I walked into my assigned patient's room ready to start the day, and she immediately told me to get out. This patient, she was known for refusing a lot of care. Whenever somebody would walk into the room, she would tell them to get out. So this patient also had dementia, and this really caused her care to be delayed. She wasn't getting her PT, her OT. She often wasn't getting her medications on time. And so we needed to use other options to allow her into our room. We went on her terms. We communicated with her on her terms. So using communication techniques such as using active listening, using expansion type questions, and noticing when things may irritate the patient and avoiding those to further communicate with the patient. And so how I learned from this, so the overall learning opportunity I learned from this clinical experience has taught me that being able to communicate with my patients and understand where they're coming from is extremely important. They're in the hospital. They're not where they're used to be, so it's really important to take that and focus it on how I can help them from that. So together, as a group with my clinical instructor, the nurse I was following, the patient, we were able to come up with how we were able to move forward, get her the care that she needed. And so how this can be connected to sexual assault. Those who are victims of sexual assault may be triggered to certain things, so it is important to inform the patient that they need to be aware of the triggers, and when one comes up, make sure you share it with others so it can be possibly prevented in the future. Sexual assault survivors may want to be left alone. It is up for them to make that decision, but they need to have the resources available for them if they need it. And so my reflective individual experience, my first one, I asked, how does healthcare differ for cultures? I was able to interview one of my friends whose family is from Macoin, might be pronouncing that wrong, Mexico. His parents came here to the United States, and then Jesus was born here in the United States, and just kind of talked to him about how his parents viewed the healthcare system in Mexico versus here, and like what kind of things that they varied. They had a big culture shock to this, which isn't shocking to any of us. Different cultures, they may view healthcare a lot differently. And so this caused them to have to think about what else was going to be changing. So what I learned from this interview from Jesus, that even though Jesus has never been really treated differently, his family has, especially his family that came here from Mexico. Experiencing a different kind of care based solely on the difference of a culture is unacceptable. And Jesus kind of talked about that in this interview. And so although he was unable to answer the question specifically, as he was not in ever Mexico to see the kind of difference, he did state how he was actually losing some of his culture because the more his family grew, they were using Spanish as often, so they were starting to use more English, which is a big culture shock when you're used to using Spanish and you go to a healthcare and they expect the Spanish, but you're kind of mixed. So that's one thing that he said. So just really using a reflective individual for that, just understanding where that can come from. And so how this can connect to sexual assault, a statistic that I found was American Indians are twice as likely to experience a rape or sexual assault compared to other races. Other cultures are put into situations that they may believe is just what their culture does without realizing that it is considered to be sexual assault. When talking to patients who are from other cultures, it is really important to remember that sometimes phrasing questions differently is really important for them to recognize those possible signs that they are being sexually assaulted, and it's not just their culture. And they do have different views, which can make it hard for them to realize that something has or still is happening to them. So with this, it is really important that as a healthcare professional, reflecting on those questions is just extremely important for those patients of different cultures. Then my second experience, I asked, what happens when a patient is all alone during the start of a pandemic? So at the start of COVID-19, I had to sit with a patient who was all alone. He always did better when someone was in the room, but he kept asking, why can't my family be here? That's really what he couldn't grasp. So sitting with an impulsive patient who was pulling out his lines and tubes, who just didn't understand what was going on, really made me sit there and think wow, it's affecting everyone differently. And for him, for someone who has the dementia and the confusion, I can't grasp it and neither can he. So really reflecting on that and seeing just like how it is that patients are out of their comfort zone, and without their family, it's even worse. And so walking the halls is really extremely different than what it was before. This has been a time of reflection because of just how different everything is now. A patient is always a lot better behaved when a staff member is in the room. And so it really made me reflect on how important support and care is for someone to help her heal. And so connecting after a client experiences a sexual assault, it's really important to make sure that they know that there's resources out there for them and they're not alone. Silent support, sitting in there with them is maybe one of the best things that you can do, or what they're ready for right now, and all that they are willing to welcome at this point until they're ready to get the other resources. Being a silent support person for them could mean the world. And so my change agent experience, my first one, I asked, how do you support a patient who is now self-conscious? Within my first year of being a nursing assistant, I had a patient who was on the floor for almost a month. She had a temporary colostomy placed, and those are usually placed for a few months. And one morning I went to go empty her drains, and the nurse walked in because she had medications due, and she just looked so down on herself. She felt that she was just so self-conscious with it being closer to summer. Just like how to hide it. She wasn't comfortable in her body with this new part of her. And so the nurse took over and started to talk to the patient and told her about these different swimsuits that you can get that you can tuck your colostomy into. And I just left that room, and I even remember just like messaging the nurse that day and being, you not only changed that patient's life, but you also changed mine. And so this really changed how I approach my patients, especially those who they have life-altering surgery that changes not only how they look, but also how they feel. This nurse that I was with took the time to really be there and sit with her patient through it and cried with her and talked to her about it. And it really made me realize that how important getting to know your patient beyond the medical side of things really is. And how this can connect to sexual assault. A sexual assault victim will not see their body as the same as what it was prior to their sexual assault. So it's really important to educate them in knowing that this was not their fault that it happened, and offer the proper resources for them. It can be very hard for victims to feel comfortable in their body after they experience it, and it becomes really important for healthcare professionals to sit down and talk to them, for them to notice their worth still, even if they do not feel like they feel worthy. And then my second experience is, what if there's conflict in the workplace? I do not like conflict. I don't like, I want to work around it. I want to solve things. So on the floor that I work at, it's a common thing to work as a team, but there are a few instances where you are working with someone who is not on the same page, and it will alter your shift. And so what I learned from this is I was able to speak up and tell this nurse that I can't do the small things as I have other things. And so if it can wait, I'd be more than happy to go in and move this patient's side table to the other side. But if she's in there, if she can do it, because that's the teamwork that we need, especially when on a busy night when we don't have time for us going in and out. When one person is in there, if they can just do that thing, and if they have somewhere else to go, start it, and then I will go in there and finish it. Just working as a team is really essential, because without it, it leaves patients' needs going unattended, which is not fair to the patient in any way. And so how this can connect to sexual assault. The best way to use this moment to be a change agent for sexual assault is to educate about sexual assault, as sexual harassment can be a big problem in the world, especially in the workplace, and this can lead to sexual assaults occurring. So educating how to prevent these from occurring is really important. And then finally, I just wanted to talk about some sexual assault awareness. So I have some statistics here. The biggest one that I wanted to touch on is every 68 seconds, an American is sexually assaulted. So if you or someone you know is affected by sexual assault and need someone to talk to, you can call this number, 800-656-HOPE or 4673. Thank you for your time, and have a great rest of your day.